This video contains discussions of mental health, medical issues, and suicide. Please take care of yourself and skip this video if you find any of these topics triggering. From March 16th to March 20th, we recognize National 2SLGBTQIA+ Health Awareness Week. Launched by a United States-based organization, National Coalition for LGBTQ Health, it is a time for all of us, the community, medical providers, and allies alike, to come together over the topic of 2SLGBTQIA+ health and work to end the disparities and challenges that we face therein. The theme in 2026 is Organize to Outlast. This year's theme highlights the disturbing reality that health services for the 2SLGBTQIA+ community are facing renewed policy challenges and calls for urgent action on all our parts to both improve access to dignified, safe healthcare and to push for better health outcomes for 2SLGBTQIA+ people in general. The National Coalition outlines 3 actions to take over the week to advance the fight for health equity. Engage with organizations doing crucial work with the community, inform the broader public, and unite 2SLGBTQIA+ folks, medical providers, and allies in the fight for solutions to the crises that plague 2SLGBTQIA+ health. It's no secret that statistics are bleak, but the specifics are still startling. Research shows that 2SLGBTQIA+ people have higher rates of certain cancers and chronic conditions as well as substance use, which itself contributes to increased health risks. HIV remains a public health concern, particularly among gay, bisexual, and other men who have sex with men, and in some trans communities. Different identities within the 2SLGBTQIA+ community face further unique challenges. Bi+ people, for example, have health outcomes even worse than the rest of the community, as discussed in our post on Bi+ Health Month. Trans folks, however, might be in the worst situation of all. Essential gender-affirming care has been the target of countless policies as of late, aimed at preventing those in need from seeking what can be life-saving care. Based on the 2010 Trans Pulse study in Ontario, 47% of transgender youth, aged 16 to 24, had seriously considered suicide, and 19% had attempted suicide in the past year. These numbers are deeply concerning. We must remember to take an intersectional approach so that all inequities in the healthcare system can be remedied. Of course, for further marginalized people, things are even worse. BIPOC folks already deal with staggering medical inequities based on race. BIPOC 2SLGBTQIA+ folks on average are more likely to report unmet mental health needs. National 2SLGBTQIA+ Health Awareness Week is a stark reminder of not only the realities that so often face folks seeking the healthcare they need, but also of the importance of equitable, accessible, dignified healthcare for all. Health advocacy has been central to Pride history in Canada by driving the fight for LGBTQ2S+ health equity, safety, and community care. We here in Canada have fought diligently for the single-payer healthcare we all enjoy, but we must remember there is still further to go in creating a healthcare system that works at its best for all Canadians, rural or urban, 2SLGBTQA+ or cisgender, no matter the color of their skin. If you're struggling, you can reach out to the Canadian Suicide Crisis Helpline at 988, or you can contact the folks at Kids Help Phone, either on the phone at 1-800-668-6868, or text CONNECT to 6868868.